Hi, and welcome to this week's episode hosted by Gray and Mark Law of St John's Health and Fitness and Mark Elm of Leeds Beckett University, where we take training theory and science onto the gym floor.
Hey everybody, welcome back to the Yorkshire Fitness Podcast. We are on episode 14 today, so and we've also, as you can probably gather if you are on YouTube watching, we have a guest with us. We were just discussing who we're actually going to say this, whether it's Mark or Mohammed, but it's nice to have a proper doctor in the house. So welcome to Nicky. No, Elm, that's not you. Welcome to Nicky. So Nicky is a client of ours who trains. How long have you been here for, Nicky? A while. Yeah. All right. Been training with us for a while. And today's topic, we've been discussing the kind of strength training benefits of people that have kind of gone through the menopause recently, because we've got a few women who come here that are kind of asking a lot of questions about it. What can I be doing to help? What kind of benefits me better? You know, is it aerobic? Hearing a lot about resistance training. It's been covered quite highly at the minute through Davina. The Davina McCall episodes that are on TV at the minute, which are kind of highlighting a lot of problems. So it's really good. So people chatting about it more. So we wanted to just dig that a little bit deeper for some of our members who have got loads of questions on how the gym floor can help with the effects of it. So that's kind of what we're going to talk about today. Same again, we'll only be going for about 30-40 minutes maximum. We want to keep them all to about similar. So I'm going to introduce you over to Nicky first of all, and we're going to have a little bit of a chat about the menopause in general.
Thank you for asking me to contribute.
Very welcome. Great to have you.
Do you want me to introduce myself for people that don't know who I am? Or?
Yes, go on.
Okay, so,
He's the worst host, isn't he? He's the worst host.
Sorry.
So I'm Nicky Williams. I'm an NHS GP. I've been a doctor for 20 years, and the last 15 years of that I've been working in a lovely practice in the Wakefield district. Amazing patients. But over the years, obviously, listening to a lot of stories from different women, how they're coping with the menopause. So I've developed a bit of interest in that side of it, and also the treatment of menopause and how we empower women to help themselves during this very difficult time in their life. That's where my interest has come from.
Yeah. So straight away, we'll just say thanks for coming in, Nicky. We did ask Nicky a specialist on this one because of Nicky's experience, obviously, as a GP. We've been asking her questions. As we get asked questions, we always pass these things on. And asking questions about it, kind of digging a little bit deeper into it. So we just thought, wow, what a great way to cover a podcast is to have somebody actually in the house with us discussing it, rather than it just being, again, us three blokes chatting about training and what women should be doing. So it's great input from you.
Yeah, we appreciate it.
So do you want to just cover, Brett, do you want to cover briefly, like kind of menopause quickly?
Quickly or
slowly? 5 minutes.
Okay. So do you want me to say really what menopause is? We want to
Okay.
So I think the word menopause, to be honest, is a little bit misleading. Meno obviously coming from menstrual and pause means stop. Menopause technically means when the woman stops having periods, so she's no longer able to conceive naturally. And normally in the UK, the average age is around 51. But what we're actually talking about here is that period of time before that, because you can only really see when someone stops their periods in hindsight. So you're looking back and saying they haven't had any periods for a year, they're through the menopause. But before that, and sometimes years before that, the woman's hormones will fluctuate, and you then start to get deficiency in certain hormones. And it's that fluctuation of those hormones that then gives you symptoms. So that's a period of time that we call perimenopause. And that's really what we're talking about here, that women are struggling with the most. And one of those important female hormones is estrogen. And you do have estrogen receptors all over your body. They're everywhere. And that is why the symptoms are so varied. So you're probably talking about every symptom you probably imagine could be down to the menopause, but the kind of symptoms that I see most widely in patients that come to me, I suppose would be flushing and sweating. That's the one symptom most people have heard of, haven't they? And around for 1 in 4 women, that will be really severe. On top of that, I think probably lethargy and tiredness is a very, very common symptom. Anxiety, low mood. So these are women that have never had anxiety before, makes them very difficult to cope with their lives, can cause all sorts of problems. And then you've got the brain fog, which I think also people are becoming more aware of. And these are women often at the peak of their careers finding it really difficult to focus at work. So there's loss of concentration, loss of memory, and women often turn down promotions or they give up their jobs before they can't cope with it. So that can be a real problem. Then on top of that, you've got difficulty sleeping. You might have dry eyes, dry mouth, dry vagina, dry everything, urinary problems. So it's everything that you can think of. And often this is a really, really hard time in the woman's life anyway. So if they're having children, the children may be leaving home, going off to college. So there may be a loss of self-worth there, and it links in with a lot of relationship problems as well. So I do see all of those symptoms, and in my experience, all of those tend to be linked together.
That does sound
Yeah,
pretty
it
rough,
sounds a bit
doesn't it?
gloomy when you think like that.
It does sound pretty rough, does that, Nicky? And us men have got it pretty cushy when you look at it like that, don't we?
We have, yeah. That's why I said after watching the Davina thing, you didn't watch it, did you? I watched it other night, the episode 2 one.
I watched the first one now.
Have you seen it now?
I think that's the great thing about what's happened here. I mean, I watched that program when I probably wouldn't have watched it before. So actually, just creating some awareness is really important. It isn't just the awareness shouldn't be a male or female thing. Everybody, I think, needs to be a bit more aware of what is happening. So you're a bit more what's going on and aware of what's happening to the people around you as well. So
I'd like more men to be aware, actually, and I think that's why the program's been excellent. And it's really good. I'm sitting here, obviously, in a room with 3 men who are keen to know about the menopause, which is brilliant.
Modern men.
But you're right. I do think the awareness over it, because it is quite. I'm not exaggerating. I was watching that at home, obviously with Kel, and they were just like, I can't believe what women have to go through it. And I've heard you've heard menopause. No, I'm going through menopause. Kind of thought of it as just being, look, everybody goes through it. You've just got to crack. Well, every woman goes through it. You've just got to crack on. And I've heard I've heard Kel talking about mates who've gone through it or going through it, and she's coming up to an age now where she's kind of expecting it, or maybe starting with that in that fit, and you just think, but until you actually hear all the symptoms and how serious it actually is, and it's just like, I came to work next day and it was like, thank God I'm a bloke, just to not have to, because it's a rough time, isn't it? And I think the more support there is, so the awareness is massive, because that will obviously put out more support there for people to get through it. It is really tough,
I think without risk of sounding even more gloomy, I think it's also important to mention that it does increase your risk of certain conditions as well. So on top of all those symptoms, actually going into the menopause, you will have an increased risk as a woman of increased risk of heart attack, for example, increased risk of osteoporosis, increased risk of dementia. So it does have real health risks as well. And I think once you link that with the symptoms, it does just sound really depressing when you talk about it. So hopefully we're going to talk about what women can do to help themselves.
Yes. Well, that's the idea, isn't it?
That's probably a good time to bring that in, isn't it, now then?
So I suppose then now, like, obviously we know there's a lot of things. We've just been talking about that a little bit before, and you were discussing HRT, so the hormone replacement and stuff like that. But you, as a doctor, you have your own recommendations that people can do to actually help themselves, don't you? Like initially to help relieve some of them symptoms, maybe, or make them not quite as severe. Yeah, so I would say if any woman's struggling, go and talk to a GP, because hormone replacement therapy, HRT, which most people now have heard of, is the first line recommended treatment for the menopause according to NICE, that's the National Institute for Clinical Excellence, and your GP will know what is safe for you. Depending on your personal risk factors, also depends on your preference as well. So we replace commonly 2 hormones, sometimes 3, that the woman is deficient in, and how we deliver those hormones varies very widely. There's lots of different methods and ways of doing that.
Can I ask, I mean, again, this is maybe my naivety. Does physical health pre-menopause magnify symptoms? Like, if you are healthier at the beginning of the menopause, are you likely to experience lesser symptoms, or if you are unhealthy, greater symptoms?
Yeah, I think that there have been studies that have shown that women who are more active have less frequent symptoms. I think the more active you are, and that's probably linked as well to weight. So if you're overweight, then you are more likely to suffer increased symptoms, particularly with the flushing. That could be worse if you're overweight as well. But being overweight also increases your risk of other conditions as well. So it's a good time to have a think about that.
Yeah. Cool. So where does, from your point of view, where does exercise fit into this then? So obviously the Davina, she's spoke of benefits of exercise, hasn't she? She's really keen on it. So where do we think this fits in?
So what I say to women and patients that I see is, obviously we might be prescribing HRT if that's appropriate, but for every single woman, I think there's things that you can do to help yourself. So it's a good time to, I think, have a overhaul of your whole self. So I'm talking about physical health and mental health as well. Have a think about things that are causing a problem for you. So for mental health, you might want to look at if you can decrease your stress at work. Is anything you can do about that? Anything to improve your mood, and things that might be going on in your life. But for your physical health, have a think about your diet. Are you giving your body a good nutritious food to help it cope with these symptoms? Think about alcohol and caffeine intake, because I do know it does make a big difference for some women, just reducing or eliminating caffeine. But the biggest one for me has to be the exercise. And if I was going to choose one thing that I'd want menopausal women to do, it would be to increase their activity and their exercise for lots of reasons. I think it helps with the symptoms, but it also helps with those risks that I just talked about as well.
Yeah, we were just talking about it then, weren't we, about how we've talked about this before when we're training, and we're dull training sessions, obviously, what we go through, but we've talked a lot about these benefits. We've just talked about it before, haven't we? How you end up in these downward spirals, and as we get older, you're naturally losing your muscle anyhow, or if you're inactive, if you're not training, you can lose your muscle, and then you lose your muscle, so your metabolism slows down. When your metabolism slows down, your weight increases, so you do less and less, which can affect your mood and all the other things, can't it? Yeah. So, but whereas the opposite, if you can keep your muscle up, and then, but we were discussing this with for menopause, for your sleep, because sleep is one of the big things. But if you exercise, helps improve sleep quality. We've said it before, haven't we, about sleep? If you exercise regular, generally you sleep better on a night. If you sleep better on a night, your mood is better the following day, and they're all very, yeah, you concentrate. So it can all help all them little symptoms, can't it? So it's yeah, so just the exercise, and then it's the type of exercise, isn't it, that we do, so that we know there's benefits for both, because we've talked about the resistance training, which can help for bone strength, can't, because we were saying about the osteoporosis, yeah, after menopause. Is that around the menopause time, Nicky, or after?
For the risk,
yeah.
So I think as your hormones decline, then your risk will start to increase from osteoporosis. So it's a good one to think about in terms of the resistance training.
So the resistance training for that, and then you also said about the more chance of cardiovascular disease and heart attacks. Increasing your aerobic training as well, like working on different things. So
cardiovascular exercise will also decrease your blood pressure, and that will decrease your risk then as well.
Yeah. So the benefits of exercise, again,
I think this to me, this kind of ties in as kind of as strength training for women, which was back in about episode 4 or 5. It was quite early days, wasn't it? And the sleep podcast. I think it ties in them to what we're just talking about, innit? Like the hormone levels, everything, the sleep. Like the better your sleep patterns, the better your hormone levels are the next day, the less tired you are, the less anxiety you will. So kind of all them tight, kind of coupled up with the training, up in your exercise, but especially the strength training. I think one thing we need to cover is quite quickly, and we'll probably pass over to you, is Nicky were just chatting earlier about a lot of people don't even know what resistance training is. So we talk quite a lot about strength training, work that we do on the gym. So we thought it probably quite a good thing to cover would just be what is resistance training. You can't just say, instead of just saying something, you need to start a resistance training program. Generally, quite a lot of people might not know what that is.
Yeah, it's a really interesting idea, because it's a term that gets thrown around a lot. And I think the 80s have a lot to do with the negative associations with that term, because around about the 80s, all you would have seen would be Arnold and Lou Ferrigno, the whole like bodybuilding magazines. And I think everybody latched on to that back in the 80s. But resistance training is anything that involves your body moving against resistance. And the simplest and most effective way for an untrained person, someone who's never done it before, will be your own body weight. So just doing press-ups and squats with no additional stuff whatsoever, that is resistance training. You're moving your body against resistance. Now, once that becomes too easy, you end up doing like 60, 70 repetitions before you get tired or just get bored. Then you can start adding things which are external to you, things that you can hold or carry or push. Now, for me, being the archetypal male that we are, it's like picking up a barbell and squatting it. But I think people jump to that because that's the only other way. But it can be anything. It could be a backpack. It could be a sandbag, it could be a kettlebell, it could be a dumbbell, it could be a resistance band. Is anything that's external to you that you have to produce some effort to move, basically, or hold still. It doesn't even have to be a movement, you can hold it still. So for example, a wall sit, like just literally propping yourself up against a wall, that's resistance training. I think what's important to mention if you're thinking about resistance training in this particular context is the bone has to be weight bearing and load bearing. So that we have to basically give the bone a stimulus, just like our muscles get a stimulus in them to move it. The bone has to have some stimulus as well. So it has to be weight bearing. So a squat is like your legs are bearing the weight of your body. If you're doing a press up, your upper body is then bearing the weight of your upper body. So if you're pushing against an external resistance, that bone gets a stimulus to grow, not longer, it'll just get more dense. So it's not going to get wider or longer. You're not going to get someone become 3 foot taller. It'll just there'll be more bone in the same space. And that's the real thing about osteoporosis, which is brittle bones probably in layman's terms, which is a risk of like a bone break. So if somebody with strong, healthy bones fall over, they won't break anything, where somebody with osteoporosis, if they fell over, they might have some kind of fracture. So resistance training is anything that involves moving against resistance. That could be as really simple as a bodyweight squat, or as heavy as like a clean or a snatch with a lot of weight. So there's a huge amount of variation with that. But I think from the conversation I have with people who aren't from our background, they assume it's like in the heavy gym with the heavy dumbbells and the heavy plates in the man section where people go with vests on and a tanned and all that kind of that archetypal bodybuilder, Lou Ferrigno, Arnold Schwarzenegger type of image, and that really isn't what it is. That's something for somebody, don't get me wrong, but there's a huge amount of other ways of doing it. Like a tin of baked beans could be a resistance training. Yeah, and that's one of the big barriers that we spoke about in the strength training episode. Yeah. That is one of the biggest barriers to stop people. I mean, I would say probably mainly women, but not just women. There's loads of blokes as well who don't want to go to a gym because of the thing. Footballers think that. Football. I have them all the time. They all think this thing. Yeah. None of us are footballers here, mate. No, we're fine. So yeah, there is barriers. So basically, the resistance training is a method of creating stimulus to promote more like your kind of muscle strength, your ligament tendons. It kind of improves joint and bone density. So if you're going through it, so obviously with the problems that menopause brings on, with the extra, because that increases the speed at which we lose bone density, doesn't it, the menopause? I think, as far as I'm aware, you'll probably know more than me, I think your muscle mass declines anyway, doesn't it? And you lose a certain percentage every decade. Just as with age, all of us. And your metabolism also goes down. So I think there's also a change in the deposition of fat. So women's bodies change, so you start to get much more fat around the middle of the body, much more of a masculine shape, if you like, more of an apple shape than a pear shape. And I think all of these things, so the muscle mass, it would help, wouldn't it? I think there's more calories, aren't there, per pound? Yeah, well, this was the thing. So that in that paper, though, one of them, I thought it was pretty good how it worded that. I've told just about everybody this for it. But number one, for how much we lose. So from the age of 30, on average, if you're not resistance training, or maybe doing a really manual physical job, I don't know, we'll lose between 7 and 10 pounds of muscle per decade from the age of 30. And I think it does start that. I think women definitely start around the age of 30. They seem to lose it more. And then for every pound of muscle that we have, burns around 35 calories a day at rest, compared to fat. To maintain a pound of fat is about 2 calories. So when you look at it on that is why people's metabolism, why they think that the metabolism slows down. It isn't because they are slowing down, but then it goes back to that knock-on effect, doesn't it? If you are losing that amount of muscle, everything's going to be that little bit harder work for you, isn't it? Walking stairs is going to be harder, everything that you do. So you're going to decrease how active you are, which will then to losing more muscle, which will then lead to your metabolism being even slower, which will lead to more body fat on it. And you get in that real rut of, I don't know. I suppose that's the decline, isn't it? It's really hard to get back. Yeah. But obviously, but you can get that back. Women then tend to get depressed about that. And then the mood, then depression. Yes. It does become whereas if you can do everything you can to maintain as much muscle as you can, your metabolism stays higher,
you're more active, you know, the walks at shops or the walk doing something with your kids or even your grandkids, whatever it might be, ain't as hard work as what it would be. And your mood is better, obviously, for being that way, innit? So rather than being depressed about your body. So
we are trying to reduce risk as well in the future. So we're talking about women's risk as well when they're in the 70s and 80s from getting a fracture. So if they do the resistance training, their muscle mass is higher, then they have a lower risk of getting a fracture. And that actually is a huge burden on families to cope with when somebody has a fracture. So if a lady has a fracture in her 70s or 80s, a family needs to look after it. That has a huge burden on NHS resources as well. So it's a good thing to think about now, and you're trying to preventative measure as well.
Yeah. So
I think, again, it just highlights the importance of it, doesn't it? Like being active and trying to stay as strong as you can, strong and healthy as you can for as long as you can. Where, you know, like in whatever. What
were the quote that you said?
Oh, that were a great
That was a quote.
You're probably too old not to exercise. I really love that, actually.
Yeah, you are too old not to exercise. Well, you're too old to exercise.
The question I was going to ask then is, so we've explained really kind of clearly how exercise is important and specific around the menopause, but in Nick, in your experience, is the menopause something that women only deal with once it starts to happen? Are they kind of pushing it down the road, thinking that's something I'll deal with at the time? So everything we've talked about, if we started that, it's going to be helpful. If women in 30s, if they did this, it'd be really helpful. But it's only something they really then think about as a consequence at the time of menopause. Is that what you say? That's true?
Yeah.
Or so?
Yeah, 100%. My experience, I think women, even when they come in and they're clearly perimenopausal, so they might be in their mid to late 40s, will still actually, some of them will be very surprised when you suggest that they might be in the perimenopausal phase. And a lot of them don't know a lot about it. It's why this increased awareness and programs that have been on TV are very, very helpful. But I think we're all a bit like that, aren't we? In our 30s, we seem a bit invincible, and you don't want to think about what's going to happen when you get to the menopause in your 40s, 50s, because that seems very old, I think, when you're in your 30s to be thinking about that. So I think there's an element of that. But you're right, if we started the exercise bit before, then it would be better. But I'm guilty of that myself, to be honest.
Yeah. So going on, have you got another question, Mark?
No, I was just thinking that it's about the messages we give them, isn't it, really? So if we're giving some general advices, there's nothing that we've said here is menopause specific in my mind. It's everything is very general. No. But I think it's just the way that we package the message. So can we give the message now in a way that it's appealing to people to start immediately, knowing the fact that if they were to carry that on through that perimenopausal stage and beyond, they're still going to have every single benefit we just described, but it's packaged in a way which is more appealing to them immediately. And so it's about the sales pitch we give rather than simply saying you must be careful because this is coming around the corner, you don't want this. Because I think, like I say, most people, irrespective of males or females, if something's around the corner they don't want to deal with, they'll just keep pushing it and pushing it and pushing it away until it's on their doorstep and it's too late. So I was just thinking from a preventative perspective and from an intervention point of view, it's like, well, is talking about the menopause as a way of like, you must do this now because this is coming, an effective way to change behaviour? I don't know what you think about that one.
I think that goes to us habits one, you know, when you start linking them in, it's like that habits, all the things that really are probably worse for us, the consequences are way down the line, aren't there? And all the things that are better for us, that if we make that decision now, the consequences are, the benefits of it are further down the line. So either one, you go for the easier option, don't you, or the one that seems more enjoyable or more pleasing at time. And I think that's like that, isn't it? If you think, oh well, I'm only going to benefit from this when I'm, mid 40s, early 50s, and you're 30, you're not going to think, oh, it's well worth doing that now. It's it's that thing, you want it, the benefits of it now, to then have that knock-on effect, don't you, and go on. So I suppose the thing. So Nicky has come with some questions there that she gets asked by patients. We've been asking for questions, haven't we?
Yeah.
We've been asking for questions. We've got some.
Have we got a new section? Ask Nicky. Is that a new section?
Nicky's asking the question.
Yeah.
Oh, Nicky asks.
Nicky's asking. Nicky's asking us the questions.
I would just like to say that I think it's important that women know it's never too late. So whatever age they are, it's never too late to start doing a little bit extra. So the resistance all there.
You're too old not to exercise, Nicky. You're too old not to exercise. It's too far on not to exercise.
Right, so these are the sort of questions that I would get asked very commonly about exercise. So what types of exercise would you recommend for menopause is a common question.
Well, I think we've almost covered that, haven't we? Really, you need to do both, don't you? You need a rounded exercise regime, really, where if you can fit in some resistance training, this is from my point of view, and some training that'll improve your cardiovascular system. So some aerobic type exercise, whether that be walking, jogging, biking, climbing stairs, then there's benefits from that in there. So I think that's quite a simple one in a lot of ways. You need to do a little bit of everything, don't you? But and I suppose then it'd be an episode on itself and how you would put that together, I suppose, and coming in, or speak to somebody. There's loads of people. We've said before, YouTube will give you loads of advice on certain exercises. Won't it? If you want that, maybe we need a YouTube channel.
Maybe. Have we got one?
Have a look.
And then I'd even more simple. That's something. I'd say something. If you're coming from the point of view where you're doing nothing, something, because anything's a start. So something, and then once you start to doing something, then you can start to branch out into different forms and types and be more focused on what you're trying to do. But I think from what we've just discussed and the little bits that I've read, if you're coming from a point of view of no exercise, something or anything will help. A walk, even like a walk in nature from a mental health perspective would be a start.
I'm quite old fashioned. I'm a big believer in the fresh air is great for your mental health, because I think if you're walking outside or exercising outside, you also get the benefit of being in nature, which is really good for your mental health. It's difficult to be on your phone at the same time, so appreciate your surroundings, have a little bit of mindfulness while you're doing it. It's fantastic.
Yeah, it really is. I mean, one of the biggest battles for that is another one, as well as the not going to want to go to the gym, we spoke about earlier, is people say they don't have time, don't they?
Yeah, a common barrier, and people feel they don't have the time, or they can't be bothered, they find it hard to motivate themselves to do it. Yeah,
that was the big one as well. Yeah. So one of the stumbling blocks we get here quite a lot is people say they can't motivate themselves to exercise, but I think it's because when you kind of dig a little bit further, it's because they think exercise always has to be high intensity, wiped out at the end of your training session, you're flat on the floor, you're dripping with sweat. Like exercise doesn't always have to be that killer session that you see on TV that's being advertised or on Instagram of the workouts, like brutal sessions, SAS. It's just exercise, like you just said, Nicky. Get out for a walk in the trees, in some woods, it's amazing. And as long as you're walking at a decent rate, you're not just really plodding, like it's better than being sat at home. It's still exercise and you're going to benefit from it massively, aren't you? So if that's your start, if that's your starting point, that's where you start. So there's no need to be anxious about it, and there's no need to put yourself off from doing it, because it's not that difficult.
I mean, we actually did our first ever podcast was about that, wasn't it? About strength training with limited time. So episode number 1 is there for people who
if you want to go back and listen to that one.
Almost like we know what we're talking about, isn't it?
Like we had this one planned. So were there any more questions, Nicky, that you had from?
No, I was going to say as well, I think the women need to, I do definitely find something that they enjoy as well. So you don't want to have to, it doesn't want to be something that is unenjoyable or something. They hate running. There's no point saying to somebody, try and do a run every week, because they're not going to do it. So if they like walking with their friends, or they like walking the dog, you can try and be imaginative with that, try and go a little bit faster with that route that you do every day. Try and take the dog to the park and jog around the park, maybe, if they want to do that, or go out with your children and play a game of football with your children. It's something that you really enjoy doing, and maybe build that into your routine, so it's really difficult not to do it. Or maybe play a team sport is another really good one. So can you join a football team or a netball team or something?
You do netball, Nicky, don't you?
I do netball, I'm really not that good at it, but I do it and I really enjoy it. And it's hard not to go, because if you don't go, you're going to let the team down. So it's a really good one for me. It's a regular thing that I do twice a week, and I find that really good for cardiovascular for me.
But there's like we were saying before, like you catch up with it could be you catch up with your friends, couldn't it?
Yeah,
like we'll meet for a walk,
well.
but you could meet up for a walk. It could be a team sport, or it could be, instead of all meeting down at pub every week or meeting at cafe and having a cake and thing, you could tie a walk in with it first, couldn't you? It don't have to be you miss out on your coffee and your little bit of cake if that's your treat for a week.
It's hard to walk and eat at the same time.
But you could go for your walk first, Matt. That's all I'm saying. You could go for it. You could say, let's meet wherever. We're in Wakefield. Let's meet at Thorns Park, and we'll have a walk around Thorns Park, and then we'll have a coffee instead of having 2 coffees. And you get a chance to catch up with your mates. So it's building things into how it fits your lifestyle, which is like your habits again, and it's just making them behaviour changes again. So again, we're going back to all the ones we've talked about, but make it so it's enjoyable, so you look forward to doing it.
It's got to be in your routine, so you can't get out of it, really, doesn't it? So you do it on the way home from work, for example. So you don't get home, sit down, and think, oh, I can't be bothered. So you've actually got to do it in your routine, or do it with somebody else. Can you do it with your partner? Learn something new together? Could you learn dancing, or could you do something you've never tried before?
Could see you and Kel doing that.
Oh, like salsa.
Yeah.
Oh, you'd be a great salsa dancer. We'd come and watch.
That wonderful. Yeah, I reckon.
I'm mindful of time. We've only got about 7 minutes left. So, Nicky, any other questions that you'd like to?
Yes.
Is
there any more questions?
So you linked that was what the best cardiovascular exercise to do, and also what's safe for somebody cardiovascularly that doesn't normally exercise. Do you get asked that quite a bit?
The best cardiovascular exercise, I suppose that depends on their kind of capability, doesn't it? Well, they're complete beginner, whereabouts are they in their training from a starting point of view? If they are a complete beginner, walking is probably as good as you can get. Get out for a walk.
What is available, what is accessible, what's enjoyable. Something I was watching the first Davina program last night, just to get prepared for that, and I'm going to say this as sensitive as I possibly can, is that what's comfortable. If that like some things may not be particularly comfortable to do, so in that particularly he's got severe symptoms, so I would imagine finding something which is enjoyable and comfortable and accessible, like that might only leave you one option once you can rule out things that for whatever reason. So it's just finding what fits that particular person at particular time. So I don't think there's a superior exercise and you work down from there. So if you're swimming, that's great. If it's going for a walk, great. I mean, like going back to what I said, if you're coming from a point of view of nothing, something will be better. So there isn't one I don't think that's greater or worse than the other. I think running, if you are inexperienced at running, trying to do that's probably the worst one for me, because I think it's most likely to cause injury. Sore knees, sore ankles, sore joints.
I think people maybe need to understand what is cardiovascular training, CV training, cardiovascular. Basically elevating you. Anything you can do what elevates your heart rate and makes your lungs work and your cardiovascular system work harder than it is at rest is a cardiovascular
So am I right? What I'm saying to patients is, if it makes you sweaty and breathless, then that's okay, because you do get asked a lot when you say to patients you need to exercise, they might say I don't need to because I'm very active in my job. Trying to explain that actually that on its own isn't enough. If you're just walking up and down, you might walk thousands and thousands of steps a day, but if your body's used to doing that, then you're not actually getting the cardiovascular benefit, are you? And then the strength, the muscle mass, and doing resistance training is additional to that as well.
So basically, your cardiovascular, you're increasing your heart rate to a level where it's having to work harder than it is just, like I say, if you're just pottering, if you're having a steady walk, if you're just kind of generally walking from A to B.
Swim in the pool, like with my head up. That's not really cardiovascular.
We did a triathlon like that.
We're swam across all sport doing that. So that's basically the easiest way to understand if somebody's wanting to start a cardiovascular routine to increase their activity levels, getting your heart rate up. It can be, it could be walking at a faster rate, a little bit quicker, like say you can time it.
It could be doing some gardening. So then there's so many things you could be doing. Cycling,
if you've got a bike, if you've got an exercise bike at home, if you've got a bike and you like to go out for a ride on your bike, that's exercise, that's cardiovascular. If you can get to the gym, there's the cross trainers, there's lots of machines in there that are just designed to do that.
Other question that I brought with me was actually that I get asked by men a lot, which is what men can do to help women in the menopause, which I think is really nice. It might be worth addressing, getting a male perspective.
We haven't got one.
Well, you haven't watched the Davina. You need to watch it.
No, I haven't watched it yet.
I would say, like, I think we just brushed about earlier, that you've got to be, for a start, you've got to be aware. You've got to know what they are. If it's your wife that's going through it, you need to know what they are going through, so you can actually sympathise and kind of understand what they're going through. Because if you don't understand it, you'd just fob it off, wouldn't you? I know that's what I'd kind of do. I'd just be like, crack on, what's wrong with you? It's right. I've had an headache last week. I went all right. That wouldn't have been how I was before. But now, just after watching that one, the episode, and then doing this bit more reading about it, it does make you realise it is quite a big deal, especially how we spoke.
Yeah.
Really, so I think you've got to be there, like you say, you've got to sympathise with them, right? You've got to understand what they're going through and kind of just be there to talk. And
a lot of it's communication. It does really upset me when there's a lot of women going through this and they don't talk to their partners at all. Some women I see have never mentioned to their husbands, partners that they are going through the perimenopause or menopausal stage in their life, and I find that really, really upsetting that they can't communicate with them. So I'd say listen as well. So be aware, listen, communicate, be patient. Sometimes they feel irritable.
Well, you just named 3 of my greatest strengths: patience, listening.
If Anna's listening to this, I'm sure she's shaking her head right now.
And giving them time as well. So maybe giving your partner time to exercise or time to relax, and maybe doing something with them so you can encourage them just to exercise together or to relax together. That would
great stuff.
So come on, men. Start it.
Be more like Matt is what we're saying.
Be more like me.
Wow, the world would be a better place.
Please, the benefit of being the end of your mid-40s.
Please don't let Anna listen to this.
Right, does that, are we happy there? Does that pretty much cover? I think that covers. I think we've done all right there.
I think we've got about a minute and a half left. So I suppose the last thing I say is, like, if somebody's listening to this and would like to get more advice, where would they go? Because obviously there's only so much advice 3 million can give. So where's the next place to go?
So just in brief, I would say it's a couple of websites that I'd recommend. If we could put the link on the podcast, that are excellent, really, really good source of information, both about treatment, risks of treatment, and things they can self-help with as well. Go and talk to your GP. If you feel you've got to a stage where you want to consider, if symptoms are a problem or you want to consider HRT, go and speak to your GP.
Perfect.
Cool. All right.
Yeah. Very good. Well, thanks, Nicky. It's been really good, this.
Thank you to Nicky for coming in. And
first ever guest as well.
And he's a proper doctor. We've started off with a high bar, haven't we?
Yeah. Set the bar. So thanks, Nicky. Brilliant.
Thank you very much.
Great.
Thanks for listening, everybody. I hope you got something out of that. Like I said, we'll put them links on the podcast so we can look at that further. All right. Cheers.
Thank you.
Thank you for listening to today's episode. If you liked the episode, we'd like you to share with us that on YouTube, Instagram and Twitter. You can listen again on Spotify and Apple Podcasts. Please leave us a rating and a review, and any comments would be more than appreciated. And hopefully you'll tune back next time for our next episode.
The Yorkshire Fitness Podcast.